Hi, I'm washing my hands. My name is Vicki Sykes. I'm a nurse practitioner student with United States University. And do I have permission to record this video and post it on YouTube for my instructor to evaluate?
Yes.
Okay, I'm here to do a focused exam of your thoracic region on your lungs. Okay, I'm going to be inspecting the rate and depth of your breathing. Um, 17 seconds for respirations. All right, and if you don't mind lifting your shirt up, I want to just see if there's, I'm going to inspect the chest cavity right here to see if there's any pectus, to see if it's caved in or pigeon chest. Everything looks normal. Let me check your back as well, sir. Okay, and if you could sit up for me, please. And lift your arms above your head. Diaphragmatic excursion is, we will be measuring that later, but his breathing in and out are normal rate, normal length of respirations, and he has a 1 to 2 ratio for his anterior posterior measurement diameter. It's a 1 to 2. Okay, so you're and also, do you mind? You can go ahead and put your arms down. Do you mind if I look at your trach right here? Look up for me just a little bit. Okay. And please, if there's any pain or anything, anytime I'm doing any part of this exam, let me know. Okay, your breathing is symmetrical, your respirations are within normal range, everything looks great. The next thing we're going to move on to is the palpitation of your chest. I'll just go ahead and do it over the shirt. In a real exam, I would ask him to take your shirt off. Okay, let me know if there's any pain or tenderness when I'm palpating. Okay, and then move forward a little bit. Do you mind just turning sideways with your legs? Okay. All right. So, and sit up straight for me. Okay, perfect. So this is what I'm doing now is I'm palpating for areas of tenderness, areas of pain, tactile, like crepitus, and things that would be abnormal. Then we can do, since we're back here, we'll go ahead and do the tactile firmitus. Okay, say 99.
99.
Go ahead.
99.
Go ahead.
99.
And go ahead.
99.
So this can be done with your ulnar surface of your hands, or you can also do it with your palms. And what you're listening for is vibrations. Go ahead.
99.
Go ahead.
99.
Go ahead.
99.
Okay, go ahead.
99.
Okay, and this is also done in the front. Okay, ready? Go ahead.
99.
Go ahead.
99.
Go ahead.
99.
Go ahead.
99.
Okay, perfect. And so what I'm going to do now is check for your oof, excuse me, your chest expansion. Okay, go ahead, take a deep breath in and out. Okay, go ahead in. Okay, now. And so my thumbs have separated, and it looked like about, I do have a measurement, and that was about 2 centimeters. So that is really good. Oh, sorry. So the next thing, we've done all the palpation. The next thing that we want to do is percussing. So there is the back side that I'll be percussing, 4 areas on the lateral side and 8 areas in the front. And you want to use a ladder technique, and I take my third index finger and I percuss. And you want to listen for fields of resonance versus dull fields. With dull fields can show signs of consolidation. Would you mind lifting this area up? Thank you. side, this arm, please. Okay. Whew. Excuse me. And now that we've percussed that area, the next thing that we're going to move on to, we've done all the percussion on both sides, and we want to do what is called a diaphragmatic excursion. With the diaphragmatic excursion is where we ask the patient to take a deep breath in. Okay, so he's going to take a deep breath in, and I'm going to get midline. I'm going to go down and percuss. Okay, go ahead, take a deep breath in. Okay, go ahead. Go ahead, let out. So I'm marking right here, and then I'm going to just fold his, you can use tape or whatnot, I'm just going to use his thing. Go ahead, exhale. Okay, so if you can see, can you move that way a little more? Just so this is the area that he has, and anywhere between 3 and 5 is normal. And I do have my trusty little measure. And his was about, excuse me, that's inches, not centimeters. His is about 4.5, almost 5. So that is the, sorry, you can go ahead and stand straight. That is what is called the diaphragmatic excursion. It's basically the dullness is where the end of the lung is. So you're able to decide, you're able to see the expansion of the lung. And his is very good. When you're an athlete, you'll obviously have a bigger excursion, and which is really great. There are specialty tests that we do. The specialty test is called bronchophony, egophony, and the whisper proloquil. So they're basically very similar in nature, and what each test is looking for is consolidation in the lungs. I'm going to do the posterior side. So if you don't mind, we're gonna, if you could stand up just for a moment, sir. So do you mind straddling the chair? And basically, so the first one we're going to do is the bronchophony. Oh, okay, go ahead and say 99.
99.
Go ahead.
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 99.
Okay. And then I want you to whisper 99. That's the egophony. Excuse me, whisper proloquil. Go ahead. Whisper. Go ahead. Go ahead. Go ahead. Go ahead. Go ahead. Okay. And egophony, I want you to say E and hold it when you hear it each time I press my stethoscope against your back. Okay? Go ahead.
E.
So in an egophony positive test, you would hear the E that I hear is muffled E. You would hear A. And on the other ones, the 99 would not be muffled. Like the whisper one, it's very soft and barely audible. In the bronchophony, it wouldn't be a muffled 99. I'd actually be able to hear it. So the last part of it is just auscultating. The 10 sides in the back, 8 sides in the front, and 4 both laterally. So I'm going to go ahead and auscultate. And what I'm listening for is bronchi, wheezing, rales, crackles. So we're going to go ahead and listen to that. Okay. And if you can, the method that I'd like you to use, I'm going to do the sides. I'd like you to put your hands together like this. And when I was listening to your back, you had your arms crossed in the front. Right now, I'm going to do these sides. And you want to get it at the xiphoid process around the 10th lung, around that region, to ensure you're not listening to organs. Okay. Okay, and if you wouldn't mind standing up so that I can auscultate the front. And then that will conclude the test. And when I'm listening, I will notice the sounds go from louder to softer because you're in your trach and your bronchial, they're very much louder. Okay, and just check your, already checked your trach and everything. I appreciate you allowing me to do this exam on you. Thank you.